Before proceeding, please make sure to subscribe and turn on the bell icon for upcoming videos. Today's video is about Amelogenesis Imperfecta. Amelogenesis Imperfecta is a congenital disorder characterized by abnormal formation of enamel of the teeth, and it's not related to any systemic disorder or syndrome. The disease involves only enamel of the tooth. The rest of the tooth structures, like dentine and pulp, remains normal. As these alterations in enamel of the teeth is developmental, that's why it's important to first understand the developmental stages of enamel. The development of enamel or amelogenesis is completed in three main stages. The formative stage, characterized by the deposition of organic matrix. The calcification stage, characterized by matrix mineralization. And the maturation stage, where the crystallites enlarge and mature. Based on improper amelogenesis in each specific stage, amelogenesis imperfecta can be divided into four types. Defects in the formative stage leads to type 1 or hypoplastic amelogenesis imperfecta. Defects in the calcification stage leads to type 3 or hypocalcification amelogenesis imperfecta. And defects in the maturation stage leads to type 2 or hypomaturation amelogenesis imperfecta. In addition, a type 4 amelogenesis imperfecta is also recognized, characterized by hypomaturation and hypocalcification of enamel. Or let's say a mixture of type 2 and type 3 is known as type 4 amelogenesis imperfecta. In type 1 or hypoplastic amelogenesis imperfecta, inadequate deposition of enamel matrix is observed. The amount of enamel present will be normal. The teeth exhibit either complete absence of enamel from the crown surface, or there may be very thin layer of enamel on some focal areas of the crown. Hypoplastic amelogenesis imperfecta is subdivided into four other patterns, which are the generalized pattern, the localized pattern, the smooth pattern, and the rough pattern. The generalized pattern affects the entire dentition. Pinpoint pits are present on the buccal surfaces of the teeth. Later on, staining of the pits may occur. The enamel present in between these pits is of normal thickness, hardness, and coloration. The localized pattern affects only some teeth in the oral cavity. Large defects on the buccal middle third of the teeth are seen. In the smooth pattern, the enamel exhibits a smooth surface, which is thin, hard, and glossy. And in the rough pattern, the enamel is thin, hard, and rough. The hypocalcification amelogenesis imperfecta is associated with soft and cheesy enamel that is lost rapidly and diffusely after eruption. The enamel can easily be removed with a blunt instrument, and much of the coronal or incisal enamel is lost as the teeth comes into function, except for the cervical portion of the teeth which are left. The type 2 or hypomaturation amelogenesis imperfecta is characterized by adequate deposition and mineralization, but inadequate maturation of crystallites. It's further divided into two patterns: the pigmented pattern and the snow-capped pattern. In the pigmented pattern, the enamel has a mottled and brown appearance, while in the snow-capped pattern, zone of opaque white enamel is seen on incisal or occlusal edges. The treatment for amelogenesis imperfecta can be done in four ways to support the aesthetics and dental sensitivity. The treatment options are the facial veneers, full coverage crowns, dentures, and overdentures. If you think this video was helpful, please like, subscribe, share, and comment if you have any questions. Thank you for watching.